Hello everyone, my name is Dr. Anil Kamath. I am a senior consultant surgical oncologist at Apollo Hospital, Bangalore. So most often patients with periampullary cancer and pancreatic cancer, they present with jaundice first to their medical gastroenterologist. It is the medical gastroenterologist who usually makes the diagnosis of a periampullary carcinoma or a pancreatic carcinoma. What I would like to speak about is that while referring these patients for surgery, what are the points you should keep in mind? So let me address them one by one. First of all, patients with these periampullary and pancreatic cancer have jaundice. Sometimes there is a tendency to routinely stent these patients. I would like to tell that this routine stenting of patients is not useful and it can be harmful. So unless the bilirubin levels are very high, say above 15, these patients should not be stented. Of course, I can understand that sometimes these patients may need time to decide about their surgery, and during the intervening period, so that the patient doesn't go into cholangitis, we might have to place a stent. If a stent is to be placed, then a covered metal stent is preferable over a plastic stent. Apart from this, what are the other things? How is the quality ensured in Whipple surgery? Whipple surgery, as we all know, is one of the most complicated surgeries done by the surgical oncologist. So, the more the surgeon is experienced, volumes are directly proportional to outcome. This is a well-known fact. If someone is doing more number of cases, the results too are better. This surgery has got a learning curve. So, an experienced surgeon may be able to do it in a much more safer manner than an inexperienced surgeon. The second point is that when an experienced person does it, there is a higher chance of a R0 resection, that is, no residual disease left behind. We know that if there is a microscopic positive margin, the results drop down quite a bit. There are various surgical techniques to ensure a R0 margin. So this depends on the experience of the surgeon, and definitely a more experienced surgeon will be able to give a higher R0 resection rate. Sometimes the patient may not be suitable for upfront surgery, especially borderline resectable patients where there is some suspicion of vascular involvement. These patients may have to go for neoadjuvant treatment where they take chemotherapy first or radiation first. The next thing is we have to think not just of the surgery but also the complications. Patients who undergo Whipple surgery can end up with life-threatening complications. This may include leakage from the pancreatic or jejunostomy site, which may digest into the blood vessels, leading to severe bleeding, where we can lose the patient. This requires intervention by a radiologist, where they can do this one and block the bleeding vessels. Only when such facilities are available, we can ensure that the patient goes back home in a safe manner. So these are the various things which have to be kept in mind while referring a patient for a Whipple's operation. Thank you.